Hello everybody, this is the vodcast on anxiety disorders and obsessive compulsive disorder. Alright, so as we've done with other disorders, we want to first think about anxiety in the context of normative development. So we see with children that it's obviously very natural to experience emotional arousal, getting upset, crying, feeling worried, feeling anxious. But what's important is that we also see individual differences in what we call emotion regulation. And we've talked about that a little bit before. Emotion regulation is a developmental process. It goes on independently within the child, right? When they choose to try to not cry, right? Or keep their facial expression looking a certain way, even though they might feel really upset on the inside. It's also something that happens within the context of caregivers, right? So we help children soothe themselves and we provide comfort to them. So it happens both independently and in the context of good relationships with caregivers. And it's something that emerges developmentally over time. We see children using a variety of different strategies to engage in emotion regulation. There are emotional strategies like the facial expression example, right, where they might try to control their facial expression or exaggerate a facial expression depending on what they're trying to regulate. There are behavioral strategies when kids ask for help, for example, and cognitive strategies. So if they're feeling very worried about something, they might intentionally try to get their mind off it or distract themselves or think about something else. The individual differences in emotion regulation that we see in kids can often be traced to a variety of factors, and that's why I just mentioned the biopsychosocial model here. We want to think about the fact that it is normal to have experience of anxiety and fear and worry. And that's because there's an adaptive value of experiencing fear or concern or wariness, right? For example, stranger danger. So that sort of gut feeling that we get as kids and even as adults where something is not right or something makes us uncomfortable or we're fearful of something, oftentimes that is an adaptive behavior to prevent ourselves from getting into a dangerous situation or experiencing harm or injury. So we do want to remember that there is an adaptive value of experiencing anxiety and other negative emotions like fear. I want to clarify some terminology here of fear versus a worry. Fears are anxieties that are elicited in the presence of a specific stimulus. So someone might have a fear of spiders or thunder and lightning or a fear of the dark. So it has a specific orientation and a very current orientation. Something has presented itself right now and you experience fear from that. Worries have more of a future orientation. Anxieties about possible future events where you feel that you are out of control and have no control over the outcome. Maybe if getting a bad grade, of your parent dying. In table 11.1, you might want to refer to that for some other examples of typical childhood worries and fears. But generally they cluster into three categories for children. Worries about health for themselves and others, worries about school, and worries of personal harm or danger or injury. 70% of kids worry now and then. Right? So again, going back to that adaptive, normative aspect of child development, it is normal to have feelings of worry. 70% of kids worry now and then. But in the typical situation, it's transient, right? So once you use one of those strategies, ask for help or think about something else or get out of that situation, then the worry goes away. So it's transient or fleeting. And also, most of the time it has an adaptive value, but we'll see in the anxiety disorders that experiencing fear and worry is in the context of maladaptation, right, where it's not helpful. All right, and so now getting a little bit deeper into anxiety and anxiety disorders. We can define anxiety as a mood state of strong negative emotion and bodily sensations of tension in which the child apprehensively anticipates future danger or misfortune. With anxiety disorders, they're thought to have a developmental course that is pretty stable and chronic. The anxieties are excessive and debilitating. One of the most common disorders, or disorder categories, is anxiety disorders. The lifetime prevalence is somewhere between 8 and 30%. There's different numbers in your textbook and different numbers in various articles, but it's highly variable depending on what age we're talking about, what gender we're talking about, and even what specific anxiety disorder we're talking about. But it is, big picture, one of the most common disorders. Less than 20% of kids actually receive services for anxiety disorders. If we compare that to something like 45 to 60% of children with conduct disorders, attention deficit hyperactivity disorder, and ODD, those children, 45 to 60% of them are receiving services. So there's a variety of reasons for that. It's been speculated that anxiety disorders are more internal, less externally disruptive to other people, right? Think of conduct disorder and ODD and ADHD, where it sort of impacts others' environments. It might be something that's more noticeable. Where anxiety, it's hard to say, oh, that person has a knot in their stomach, right? It's something more internal. So there's a variety of symptoms of anxiety. Some physical symptoms, this is just a sampling. Increased heart rate, dry mouth, dizziness, nausea, fatigue, sweating, increased respiratory rate, muscle tension. Cognitive symptoms, so how it might affect your thought patterns, thoughts of being inadequate or incompetent, thoughts of going crazy, feeling self-critical, being scared, have difficulty concentrating, and some behavioral manifestations, avoidant behavior, averting eye contact or gaze, biting your nails, fidgeting, clenching your jaw, crying, for example. With anxiety disorders, the fight or flight response is often involved, right? So I just want to remind you of that, that is a normative aspect of our nervous system. The fight or flight response comes from the autonomic nervous system. It's our immediate reaction to a perceived threat, where we either engage or fight to protect ourselves, or we flee and run away from whatever the perceived threat is. And the goal of fight or flight is to protect ourselves from harm, but it's not something we pause and think about. Our nervous system just sort of takes over. This can give rise to panic. We'll talk more about panic disorder. Panic is when there are unexpected symptoms of their fight or flight response, right? So the fight or flight response comes on even though there's an absence of any obvious threat or danger. All right, so now we're going to talk about what are the main features. I'm not going to go through detailed DSM-5 criteria because there are so many different anxiety disorders, but the defining features of 7 of the most common DSM-5 anxiety disorders. One is separation anxiety disorder, where there's excessive worry regarding separating from the parent or the home. The child's unwilling to be alone. The child worries about harm, distress, and often has physical symptoms as well as distress. Number 2, selective mutism. A consistent failure to speak in very specific social situations, but they do speak in other situations where they're more comfortable, oftentimes in the home or with family. 3, specific phobia, severe and unreasonable fears and avoidance about specific objects or situations, right? So having a phobia of clowns or of nighttime or something like that. Number 4, social anxiety disorder, sometimes called social phobia. Severe and unreasonable fear of being humiliated or embarrassed when doing something in front of peers or adults. It's sort of a fear of scrutiny by other people. So this might happen when there are situations where the person needs to perform or speak in front of other people or demonstrate something. Panic disorder, recurrent, unexpected, and severe panic attacks. Worry about panic attacks. There is a maladaptive change in behavior to avoid the attacks. And just a little bit more about panic attacks. We just defined panic a moment ago. And a panic attack can feel like a heart attack, right? So very overpowering sense of physiological symptoms with racing heart, racing respiratory rate, sweating, maybe getting a strong blush response, maybe feeling like you're choking or you can't breathe. So panic disorder is characterized by experiencing panic attacks and also worrying about what will set off a severe panic attack. Agoraphobia, a fear of open public spaces. Also, and that would be something like a parking lot, for example, or a shopping mall. Being in a crowd, also fear of closed spaces, things like elevators and subways, public transportation. The trend is worry that an escape could be difficult or help won't be available if a panic attack occurs or if something else happens. Like they might worry that they're going to fall or they're worried that they're going to have to go to the bathroom or something like that. Generalized anxiety disorder, ongoing excessive worry about many different events and activities. Difficult to control the worry. Sometimes it's described as being marked by free-floating anxiety, where you can't always trace the anxiety to one particular cause, or you're just worried about so many things at the same time, a variety of events and activities. Right, and our fourth board